Hello everyone, I am Dr. Rubina Pandit, fertility consultant at Nova IVF Center. Today I am going to discuss about a very important topic, that is importance of doing a semen analysis at a fertility center. 80% of the time I have seen patients coming to me with the outside report where they have either not done the semen analysis properly or they have not mentioned all the parameters correctly. Now when I talk about semen analysis, there are three parameters which I check. One is the sperm count, that is how many number of sperms are present per ml. So the normal sperm count should be more than 15 million per ml. The second which I check is motility, that is how many sperms are moving. Now motility is of two types. One is progressive and the other is non-progressive. Progressive means that the sperms are moving forward, and non-progressive means that the sperms are just moving but they are not moving forward, they are twitching at their place. So when I talk about fertility, it is the progressive motility which is actually important, and the cutoff is more than 32%. The third parameter, which is wrongly mentioned in most of the reports or not mentioned at all, is sperm morphology. Just like we have a head, neck and a body, similarly a normal sperm has a head, neck and tail, and there is a particular criteria which is called strict criteria which is followed, where we will say whether the sperm is normal or not. So if we go about the cutoff value, in case when we examine about 100 sperms, at least 4 should be normal. But what I see in most of the patient report, they will be mentioning at 60%, 80% normal morphology, which is practically not possible. So that is why I always urge all my patients to get a semen analysis at a fertility center by a certified andrologist, because once the sperm morphology, we notice the sperm morphology, it is one of the most important parameter to evaluate the sperm quality. In case if the sperm morphology is 4%, we know that the patient can try simple treatment like ovulation induction. But when we have to decide about IUI and IVF, it is the sperm morphology which plays one of the most important part. So if the sperm morphology is 2% or more, then the patient can definitely try IUI cycle. But if the morphology is 1%, then the success rate of IUI decreases drastically from 30% to 10%. And 1% morphology means that the patient has to plan an IVF cycle as soon as possible. So I urge to all the patients and to all the people who are seeking a fertility treatment, always and always get a semen analysis done at a particular fertility center and not just at random lab, because we have burnt our hands so many times seeing a normal report, trying normal simple treatment, and after 6 months getting a repeat analysis done and seeing a complete opposite report. Thank you.